Tonight's speaker is Dr. Chris Carruthers. Dr. Chris Carruthers is an engaging educator who has helped thousands of people with heart disease, cancer, depression, and chronic pain improve their sleep. No, I don't want you to talk about that? No. You'd rather spend time talking yourself.
I would.
Get over here then.
Okay, so welcome especially to the people who are here for the first time at the meeting.
Presentation.
Oh, thanks. I'm honored to be here. I've been involved with this group before for many years. I think the first time was almost 10 years ago. And I do see some faces that I love and care for. It's wonderful to see you. So the reason I started saying you can trust me. I have had a sleep disorder and I've completely recovered from it. It was very serious, but I have not had cancer, so I don't necessarily understand what it's like for you to have a sleep disorder together with cancer. It can be very complicated. But I was for many years part of the patient education program at the Tom Baker Cancer Center, so maybe that's where some of the faces come from. I hope maybe we've met before, which would have been wonderful. And I think we just have till 9 o'clock, right?
We'll give you an hour as long as they stay awake.
Yeah, no, I was saying to Willem, I totally, no, and I said to Margaret, if you want to have a nap, I'm completely fabulous with that. In fact, let's see the second slide there. Then we'll go this way.
What's that?
So at 9 o'clock, you're going to get a wake-up call. So if you want to be asleep, that's fabulous. All right, so you've had your AGM, and not that that wasn't fascinating. It really was. It really was. But we're going to have some fun. And I know I could present a medical lecture. I'm not going to do that. I looked at my slides that I usually use in this type of presentation, and I pulled out over 2/3 of them. I still may have too many, so I may be skipping over them because I want us to have some fun, and we're going to practice some techniques for sleeping better. I want this to be really practical. I want you to leave the room at 9 or after you've had your social time really thinking that, yes, I learned something new, I'm going to try something new, maybe there's a bit more hope or whatever, you're just feeling more supportive. I don't care what it is. I just want you to feel better when you leave the room. I want you sleeping well tonight. You can sleep better tonight. It's up to you. You are in charge. Not your doctor, not me, not any health professional you're going to talk to. It's all about you and how fabulous you are. So I have a handout for you. Let's go back here for a second. Here's what the research says, that almost half the people with cancer do have trouble sleeping, and I think the incidence is actually a little bit higher than that. And this stat it's not just prostate cancer, it's all cancers. But the incidence of sleep dysfunction in the normal people without cancer is actually almost as high as this, about 30 to 40% too. So you're not alone. Not that that helps you when you're lying awake at night, feeling fatigued, or in the middle of the day you're thinking, wow, I need to stay awake and I can't. So I want to ask you something. Think about how severe or mild is your sleep problem. Okay, no, let's say it this way instead. On a scale of 1 to 10, how well on average have you been sleeping over the past week? So the past 7 days. So think about that number for a second. And then we're all going to actually put our hands up, and I'm going to call out the numbers. The number 0 is low, or 1, very, very poor sleep, 10, fabulous sleep. You wake up, want to take on the world. Okay, so what's your number? So everybody's hand up now. And if it's 0 or 1, put your hand down. Everybody's hand up, okay? Have that number in your head. If you slept so poorly, it was 0, 1, just pull your hand down. 2s, hands down. Wow, okay, 3, hands down. 4, 5, a lot of people not sleeping well at all. My heart breaks. 6, 7, got some good sleepers too. 8, 9, we've got not some fabulous sleepers, but some pretty good sleepers. Fantastic. Well, I don't know if you saw what was happening in the room, how many people between, to the score of 5, already their hands are down. So it's a serious problem. You already know that, but I swear it's even more important that you know even more about it and are become more committed. If that's the case for you, you need to take this seriously. And I can't stress this enough. I'm not going to give you a lot of stats and data. My point of view is, you know what? No matter how severe it is, no matter how difficult it is, no matter what has caused your problem, I want to be giving you some practical tips to get better right away, all right? So your sleep disorder is probably really complex, but the solution is not necessarily, all right? Okay, so if you have prostate cancer, what we know now, this is a new study out of Iceland, and it's pretty dramatic. It's been all over the media. Maybe you guys have discussed it in your newsletter. I love your newsletter. It's so fabulous. So a study in Iceland, over 2,000 men, looking back on their history, those people who developed, the men who developed prostate cancer, looking back, you could see the correlation with sleep dysfunction. All right? So I want you guys, and women, you can help your men to think back before your diagnosis of prostate cancer, or even when you were a young child or a teenager, did you have problems sleeping? And it's likely that you did. Now, what comes first? You get your diagnosis, you have a lot to think about, a lot of critical decisions to make, a lot of disruption in your work, your lifestyle, etc. That can cause a sleep disorder, even if you didn't have one before, for sure. Does the sleep disorder cause cancer or increase your risk for cancer? Yes, it's clear from the research now. But it really doesn't matter how you sort it out, right? It doesn't matter what comes first. It really doesn't. And it gets complicated too as the layers interact with each other. Like I said, let's just be practical about it. Tonight, I have some steps for you. You can learn to sleep better. It's a partially learned behavior, all right? And you have the skills to do better. I don't want you to just say, oh, life is tough. I can't sleep. When I talk to people about health change, and I forgot to mention, I'm also a consultant. 70% of my time is with Alberta Health Services in the knowledge management team. So I'm helping people communicate better with each other. Actually, when I say people, I'm talking about health professionals. Can they please communicate better with each other so that they're also communicating better with patients and families and really listening better to what you want? So I talk about learning a lot. Learning takes commitment. You really need to know that you're capable of making this change. And everybody in the room is. You have that power. The psychoneuroimmunology powers of your intelligent body can be brought to light at any time. All right? So that's very encouraging. You're not healthy if you're not sleeping well. Oh, I know what I was going to remind you. We spend 1/3 of our life sleeping, and I see people, they're taking training courses to do better at work, they're improving their career, they're taking parenting courses, they're taking financial management courses. I never see anybody taking a sleep course. Just spend more time sleeping than doing any of the other things. And it's more important than any of the other things. Now you could argue with me, and that's okay, I don't mind a really good argument. But from my point of view, and looking at the clinical literature now, if we look at the lifestyle habits that affect the development of chronic illness and cancer, of course, you know all about diet, you know all about physical activity. Sleep has been ignored. How many of you even have visited a physician who's never asked you about your sleep? How many? Lots of you. And it's just shocking, and it's changing, but you know, the research had to kind of come first. So it's really important. It's one of the most extraordinary things our body does, and it's really complex, so we don't have time to talk about it. Certainly as your treatments continue, your sleep dysfunction can get worse. And like I say, it exacerbates each other. You're not sleeping, you become kind of maybe sad and discouraged with that. That may exacerbate some depression that maybe was standing before. Then you kind of worried about not sleeping, and it just gets layered and layered and layered. And radiation fatigue, you don't need to hear me tell you about that. It can be difficult. The fatigue that's in addition to having cancer, certainly, as I said, your side effects, the tumor progression, the changes in your gastrointestinal system, your respiratory system, your endocrine system, hormonal changes maybe related to the drugs you're on, all of these things interfere with your sleep. Not one single thing is helping you sleep better, is it? Related to cancer. It's maybe time off work, but no, I'm stretching it, right? More nap time? I don't know. Changes in your medications, brain fog. Anybody getting that? Had that? Been there? I have that too, and I have no excuse. All right, so here's what can happen. Even if your situation is all that has been described here, I really want to help you. I'm going to talk to you first about the websites that you can link to. So I handed that out to you, or I didn't, but, oh, I got one. I got one. Just real quick, I'm going to skip over this too. These are specific sites for sleep, not necessarily for cancer. And if you want to know a bit more about my recommended sites for cancer and integrative cancer care, you know, blending conventional care such as you get at the Tom Baker plus the integrative oncology, like all the therapies that used to be and still are considered more complementary therapies. Putting them together, I can get that sheet to you too. And maybe I'll send a list. You can sign up for that if you want to. But I want to let you know about the first couple here, Medline Plus Sleep Disorders. These sites are amazing. And this is why I don't need to spend too much time on the architecture or hygiene of sleep or whatever, because you can go to the websites if you like the computer. Medline Plus is the place to go for any health information, can give you any drug information, any natural health product, a description of any test you might undergo. All right, so it's all there for you at Medline Plus. That's National Institutes of Health. Drug supplements, there's videos, tutorials, all kinds of information. Now, if you want to do some polls or quizzes, there's all kinds of things to play with. Tips for shift work, how to buy a bed, it's all on here, okay? Want to make sure you have that. I've got some recommended books and CDs at the back, and I'm going to circulate a few things while we're talking. One of my favorite ones is the Dr. Seuss sleep book. My favorite sleep book. It's fun. Pass that around, and I'll give you these to pass around too. They're all on your list, except for Dr. Seuss. He's not on the list. He should be. Okay. And just speaking from the literature again, what has just been published recently in the cancer.gov website is this statement. There is a new role now for undisturbed, high-quality sleep as a previously unappreciated method to decrease cancer risk. So for some of you, you're beyond that, but we're understanding more about what decreases cancer risk, and do the same methods or behaviors or approaches, thinking, beliefs, etc., decrease your risk of recurrence as well. Seems to be the case, so you just take that with a grain of salt. Did you know this? I know you're not rats. You're not rats, but rats deprived of sleep deliberately in a lab will die. That's how fast they die. Sorry, Willem. 3 weeks. 3 weeks. Yeah. So, you know, you can go without water and food for a while, but sleep, you know, you'll succumb to sleep too. And this is why sleep deprivation is used in torture, and it's all related to your immune function and how your immune system needs to recover itself during the night. All right, so the endocrine system needs sleep to continue its cycles. Certain proteins, cortisol, prolactin, all the kind of male-female hormones, very critical fluctuations during sleep. You need light and darkness, you need your sleep. And it's important for your brain function. Have you noticed if you're not sleeping too well that you have trouble with your memory? Does anybody, who's noticed that? Yeah, it's one of the first things, hey? For me, actually, I become more irritable and more impatient. That's the first thing that shows up for me. Anybody else? Or just me? Oh, a few of the ladies. A few of the ladies. Yeah, these are signs of poor sleep. You might think, oh, I have work stress, I have this, I have a decision to make about my care. It's all true, you certainly have that. But if you focus on your sleep first and find ways to sleep better, those decisions and those stressors, you just seem to manage better. I'm sure you've noticed that. But the actual cognitive functioning, your brain is not going to work properly if you're not sleeping properly. Now, you feel it mostly in your body. Some of you feel it in the brain. But your brain is very busy during the night. Your brain doesn't stop working. It's just working on different things than it does during the day. So what happens is, during the day you're busy socializing, you're busy thinking, you've got your left brain working, etc. That kind of does shut down mostly at night, and the other areas of your brain that are not exercised during the day are very busy at night. Your intuitive self, your subconscious self. Right? Those are the pieces that get exercised at night. Otherwise, they would deteriorate. So you have to have sleep. You have to have it. Now, you all know about the circadian cycle, the 24-hour pattern. Some of the sleep disorders, actually, you can kind of offset and push that forward or back. The typical 24-hour cycle related to light and dark. I'll show you a picture in a second. But these are some of the things that really affect our body in a big way. Crossing time zones, jet lag, shift work, etc. is so hard on our systems. Now the pituitary gland, or the pineal gland, you can see there's kind of a little yellow dot in the middle. I hope you can see, I'm not sure if you can. But I want to let you know about the endocrine hormone melatonin. You've heard of melatonin before. And it is produced in the body. It has widespreading actions on many, many different systems. That's why you got to be careful if you're taking melatonin supplements. If you want, we'll talk more about that at the end. Oh, I was going to say, yeah. So when we finish, if you have questions, I'm going to make time for questions, I hope. Or if you have questions now, just put up your hand or do a handstand so I know you have a question, however you want to do it. But I'll stay as long as you want and answer questions after. So if you want to know specifically about certain sleep disorders, but I'm going to just skip over them. But the circadian cycle, okay, so what happens when the light falls on our eyes, like first thing in the morning or nighttime like this, the hormone melatonin is suppressed. All right, as soon as darkness falls, melatonin surges. And the melatonin is absolutely critical, as I said, for all these functions of the body. So that's why it's really important that you have a dark, dark room when you're sleeping and you get a certain amount of sleep. Ideally, you'd be going to sleep when it gets dark and you'd wake up with the light. Your body naturally wants to do that, even with the seasonal changes. But that's really not how we do it. So you need to manage light late at night, have dim lights, and then in the morning, open your blinds so that you have lots of light coming in. Now, one of the best things for you to do to manage melatonin is to wear a sleep mask. Who wears a sleep mask? More of you need to wear this mask. It can extend your sleep by even 30 minutes or 20 minutes will make a difference in your day. How simple is that? Whoever doesn't have a mask should have one. Do you want to sleep for another half hour? Would it help your behavior and your thinking in a day? Yes, it would. Who has a birthday today? Nobody? Who has a birthday in May? Who wants a sleep mask? You May people? It hasn't been used. It hasn't been used. I want you to have that. So you can tolerate your husband's and his illness, right? You can get those at any drugstore. $4.99, $5.99, London Drugs, even the dollar store you can get them. But you want one that's comfortable, it's going to stay on your eyes. One that's dark. My daughter made me one with big eyeballs on it. Closed eyes. Easy, there's no excuse. Buy one and wear it. Now, there's lots of steps that I want you to take in your bedroom to keep your bedroom comfortable too. Well, I'll hand those out in just in a second. It's all about melatonin. So as I said, it's an antioxidant hormone, all right, which does fabulous things in the body, as you know. It protects the cell membranes, keeps the system strong, and lots and lots to say about melatonin. I'm going to skip over the stages of sleep, but I just want you to take a taste of how fascinating sleep architecture is and how complex it is, just to reinforce how important it is that you do what it takes to sleep better. Now, during the normal night, you're going to have 3 or 4 cycles of sleep, moving like this. And we have these 90-minute cycles, usually about 90. We have them in the daytime, too. Have you ever noticed most lectures are no more than 90 minutes? Yeah, because you're fading, right? Same as at nighttime. Now, each 90 minutes, you're going through 5 stages of sleep. And during each stage, the brain is doing different things and regenerating the body in a different way. I'll show you a picture. Here's how complex it is. Now, stage 1, 2, 3, 4, 5. You can see stage 5. This is the electroencephalogram at the top, and your brain waves are going really, really, really fast. This is called rapid eye movement sleep, where you're deeply within your unconscious mind. You're dreaming. You're solving problems in your dreams. Sometimes you remember them, sometimes you don't, right? But when you wake up, you think, oh, gee, I never thought of that. That's, my problem is solved. Have you ever noticed sometimes things just seem to be clearer in the morning? Who's noticed that? Not that many of you. Yeah, we want to get you guys sleeping better. But you don't need to look at this. I just want you to know another thing that happens during the night. Let me show you here. Is the cycles and the activities within each one change the amount of time that you spend with it. So here's REM sleep here, yellow, and one cycle, an hour and a half, an hour and a half, an hour and a half, an hour and a half. What's happening to the REM sleep cycle? It's getting wider and longer. So this is really important. This is happening to you 4 o'clock in the morning, 5 o'clock in the morning, 6 o'clock in the morning. Critical time for you. That's why you need that sleep mask, okay? Cheap. Get a couple. Get some colors. Have fun with it. All right, so just everybody always asks me, how many hours of sleep do you need? And you know what? You can ignore the rule books. You know how many hours of sleep you need. Some people need 7, some people need 10, some people need 4. Well, I don't really think people need 4. But Churchill, he was taking naps all the time, and he never actually had he was famous for his naps, wasn't he, having his head down on his desk, yeah. Aging, we sleep less, but that's not, this is a misperception a lot of people have. Your body does not want to sleep less. It's not a natural progression of aging. Okay, so ideally what you want to notice as you get older, your sleep pattern stays the same. So there's lots of reasons, though, as we get older that our sleep is interrupted, usually illness, etc. Right? But it doesn't need to be that way. Stimulation is going to change your variation of sleep, the climate. We sleep less in summer. Who knows why? We just talked about it. Yeah, more light, hey? More light, yeah. So you have to manage that light. Who has a computer in their bedroom or a television in their bedroom? Speaking of light, nobody puts their hand up. Could be the way I direct that question, couldn't it? No, who does? Who does? Who has, yeah, that, oh. See, what happens is, your brain is so sensitive. When you're looking at a computer screen or any electronic screen, like an LCD from your, like your clock radio, that is going to stimulate and change the levels of melatonin and hormones being produced in the brain. So you're going to wake up. Don't do it. You shouldn't be watching television before you go to sleep at all. That is it's an unnatural light, and it's a difficult light for your body. Now, I think, oh, you can tell how strongly I feel about this. Kids with, the teenagers just seem to do it. Everybody, not necessarily kids, probably some of you kids. Do you have your cell phone in your bedroom? You're looking at your cell phone. Okay, good, yeah. Any electronics need to be turned away. You don't want your eyes falling on light during the night. Even if you get up to go to the bathroom, many of you do, right? Try to keep the lights low. Don't turn them bright. Keep them very, very low so you keep that melatonin coming. You don't want to inhibit it. Sleep debt, I'm going to just skip over this. Oh, here I'm on my high horse again. How many of you have been driving and you notice, oops, How many of you? Has it happened to you? You have fallen asleep. Do you realize that? You have fallen asleep while you're driving. And so the stats, Canada, here's some of the stats about sleep dysfunction, sleep disorders and accidents. And these are a couple years old, but I'm sure it hasn't changed that much. Oh, sorry. Driver fatigue causing over 100,000 car accidents annually in Canada. 1,500 people killed. Cause of accident, driver fatigue. 1,500 people killed. Completely preventable. You may know of some of these situations. That is just not, it's not okay, right? 71,000 injured, etc. So I want to talk to you about safety. It's a health issue for sure, but it's a safety issue for sure. So I'll just tell you about one study. Well, we know this from data that people who are drunk doing a psychomotor test, some of them can actually do better than those who are sleep deprived. And so that's not good news. Many global disasters seem to be related to sleep deprivation. The BC ferries, I think it was a year or two ago, was related to sleep deprivation. People losing their lives. So it's so serious, and your health is even more important. So William Dement is one of our leading sleep researchers. He said there should be sanctions against that. Somehow we need to find a way to track people and find them. We find people and pull them over if they're driving under the influence of alcohol, and if you're under the influence of too little sleep, you're just as dangerous. You're just as dangerous. I don't know how you feel about it. You don't necessarily know when you're tired. So I made a list of symptoms. Oh, here's the studies I want to tell you about. I'll tell you about this second study. The elderly denied falling asleep at a deliberately boring lecture. So here's what happened. There was someone giving a lecture, maybe someone like me, and there was a videographer, maybe someone like Brett, and he's looking to see who's staying awake and who has a little nap during the lecture. So this was deliberately planned, and then this group of elderly people were asked, how many of you felt really tired and had a little rest? And nobody says they did. And almost all of them had fallen asleep during the presentation. So they didn't really realize how tired they were. So you really have to watch for symptoms like this. Now, I mentioned irritability. That's one of my biggest ones. If I'm irritable, there could be lots of other reasons, but it could be simply that I haven't had enough sleep and I need to focus a little better on sleeping. All right? So what is it for you? Do your shoulders get stiff? You may not identify this as you're not sleeping well, but these are the symptoms. Tired eyes, droopy eyelids, even the kind of the fatigue within your legs. Like I say, it's hard to know. There could be lots of other things causing this. Sleep should be the first one you think of. What do you need to do? Weakness, boredom, lack of motivation, anxiety. All right? So try to watch for your signs of fatigue. If you're feeling making more mistakes, I don't know if anybody makes mistakes. You leave your keys, can't find your keys. Do you ever lose things? Most of us never lose things, right? Yeah. Have you ever noticed if you're still working, you have vacation, and you're suddenly just sleeping your whole vacation away, or you become really sick on your vacation? This is related to lack of sleep. Serious. It's very serious. Your doctor should be asking you about all this. He or she probably isn't, so you have to say, don't you want to know about my sleep habits? All right. Your partner knows if you have a sleep disorder. Okay, I'm going to hand something out. Can everybody have one of these? And we're going to analyze our sleep, and we're going to fix a few things right away. Sleep disorders, once you do, if you have sleep apnea, a come and talk to me if you want. We'll talk a lot more about sleep apnea together, the 2 or 3 of us who want to do that. It's a very, very serious problem. If you can correct it, you're going to feel so much better. It's going to be absolutely amazing. Is there anyone in the room who uses a CPAP machine for sleep apnea who would say, how is it for you? Does it help you? Yeah? Did you have trouble getting used to it? A week, okay. So I'll show you the picture. Now listen, some of you may have, here's what a CPAP machine, well, they don't look like this anymore, but what it is going to apply some airway pressure to your breathing so that you're not kind of choking and gasping for breath. Now, if you have a partner who seems to almost stop breathing a little bit during the night, he or she may have sleep apnea, and it needs to be taken care of. Once you manage it, you do feel so much better, don't you? Yeah, it can really change your life. In fact, a friend of mine here at the Kirby Center, I remember him saying, I play tennis with him. He said it absolutely changed my life once he was able to deal with it. So that's really important. It's quite prevalent. Jet lag syndrome, etc. We'll talk about those one-on-one. I'll stay as long as you want to do that. Restless leg syndrome. Some of you may feel that crawly sensation in the legs, very difficult at night. Now, whatever is causing you not to sleep well, the solution is the same. Okay, let's look at our list. First thing we need to do is improve what we call our sleep hygiene and our sleep environment. And okay, I better get one of those. Oh, here I have one. Okay. Now, how many of you have blackout blinds on your curtains that keep it really dark for you? Okay, lots of you do. How many of you wake up too early in the morning? Blackout blinds, everyone. That's one easy thing to do. There's no reason not to do that. You know, you have to plan on Saturday, you're going to go to Costco or whatever and buy some blinds. It's the first thing to do is to manage your sleep environment. And if you're not doing that, you're compromising your health. And you have cancer, you have had cancer, you have a partner with cancer, your family cares. We want you to feel better. Do these things. Just don't wait any longer. Very, very easy solutions. Blackout blinds. You need that dark room. Now, if your bed partner is making it tough for you to sleep, I won't ask, does anyone have a bed partner making it? Okay, you need your own bed, maybe your own bedroom. Now, I was just recently talking with Calgary Police Services about sleep health to translate to Alberta Health Services, to the people doing shift work at Alberta Health Services. What do the policemen and women do who are out on the streets and they're doing shift work and they're working 12 hours, 14 hours? How do they manage their sleep? You know what they do? They create a cave. Just the way bats do. Bats sleep, right? Very well. You need a cave. Dark room, lots of circulation, fresh air, no noise, very black. Create your room. That's how important sleep is. Say to your bed partner, see you later, I'll come and visit or whatever, but that's what you need for sleeping. How many have done that? Some of you have. Has it worked for you?
It has to a degree, but the cave I go to, the bed is just comfortable.
Oh, yeah, yeah. Time for a new bed in your cave, though. But do you need a new bed there? Yeah, for sure it's always going to be more comfortable with your partner, but you still need a cozy bed. You need to love your bed, love your linens, love your pillow, be in love with your bedroom, all right? Who can think of something they're going to change in their bedroom right away? Tell me. What is it?
The blackout blinds.
Yeah, yeah. It just to even extend your sleep a little bit will make such a difference. It really will. So I want to encourage you to do that. Now, caffeine. People who loves caffeine? Yeah. Oh, just this corner. It's not interesting. Oh, everybody else is not telling the truth. Green tea, cola, chocolate. Who loves chocolate? Yeah. Okay, listen. Caffeine clears from any source, clears through your system very, very, very slowly. You really shouldn't consume any caffeine after 2 o'clock. 2 o'clock. Not 7 o'clock. We used to say 4 hours before you go to bed, etc. But the half-life is so slow. So nothing after 2 o'clock. Easy fix, all right? What's that? Sorry? What's the question? Is there caffeine in beer? I didn't think so. You can, oh, you know what? I'm all for that, actually. You will need to get up during the night and go to the bathroom, but no worries. You can get back to sleep. I'll show you how. Now, who has pets sleeping with you?
Define pet.
Oh. I don't know if I want to go there. But what? In the room, yeah. You know what I was going to say? It's okay if your pets sleep with you if they're not disturbing you and you're comfortable and you're getting along and everybody, it all works. But if you're having trouble sleeping with your pets, you really have to make a change. I know that's hard. Physical activity, I actually like to exercise later at night before I go to sleep. Most people say that doesn't work for them, but it just tells you how individual you are. So what works for you is, that's all you need to know. And how to know it's working. One thing, when you think about your thinking around sleep, and your thoughts before you go to sleep. One thing I want you to think about is your energy level during the day. If your energy level during the day is failing you, or you wish you had more energy, you need to address your sleep for sure. But even if your sleep is disjointed and you have good energy during the day, then you don't need to worry about it. You don't need to say, oh, I only had 5 hours of sleep, or I woke up, or the cat woke me up, or whatever. Measure it by your energy level during the day, all right? That's the thing to focus on. Don't be too concerned about what happened during the night, all right? Now, shift work, some of you may be doing shift work, traveling through time zones. Just what I want you to do is make note of the 3 of the things that are the most troublesome for you. That's all I want you to do for right now. In the next couple of minutes, I'm going to teach you 3 techniques, and I want you to commit to doing a few things over the next couple of days to solve these problems and practice some sleep techniques.
Is that before Monday?
Pardon me?
Is that on a website somewhere?
Oh, yeah, no, good question, William. No, it's on my website, though. You know what I'm going to do? I had forgotten, I'm going to circulate a list. I have a newsletter. If you're interested, you can go to my website, chriscarruthers.com, and you can get some of these resources, including a sleep diary. I'll show you the sleep diary, which is an easy thing to fill out and then take to your doctor when you're ready to visit your doc. See if I can find it. Well, I'll just tell you about it. It's on my website. You can just download it. And this is it comes from the American Society of Sleep Medicine. The reason I like this diary is you tabulate the exercise that you took during the day, when did you eat, did you have a nap, did you have caffeine, coffee, etc. All those pieces are very, very important, much more important than the figure, did you sleep 5 hours or 7 hours, etc. All right? Your doc can help you figure it all out because your sleep, your brain function, as I said, is interrupted in different ways based on the interruption of the patterns as you're sleeping. Cognitive behavioral therapy is helping you think better and manage your behaviors around sleep. How many of you believe you're really bad sleepers? Who believes they're a bad sleeper? Well, I want you, that belief alone is going to keep you being a really bad sleeper. Question?
Yeah, I'm thinking that I might not be alone on this, but what about waking up at like the wackiest hour every night?
You're not alone.
Right?
Who else?
Specifically 3:30.
3:30 is your time?
Yeah.
What time is yours, Ed? What time are you up?
3:30.
3:30. Anybody else 3:30? We'll go on video conference together. What can't be solved usually is what's causing you to wake up. And I don't want to discourage you, but you know, if you have chronic pain or you need to get up to urinate, those things are just going to continue to happen until they're managed, but it's chronic, it takes a while to manage, right?
I have neither of those.
Okay, so what do you think's causing you to wake up?
That's my question.
What do you, yeah, well, what do you think is causing you to wake up? When you wake up, what's happening?
Mind chatter.
Anybody else got that monkey mind going on? Lots of us. And all right, let's manage that, because that's probably one of the easiest things to manage. First thing to believe is that you're in charge of what you think.
Yeah, so like, just you would recommend maybe a
Techniques?
centering exercise.
Yeah, okay, let's do it. We have time. There's 3 things we're going to do. The 3 skills that I recommend are the ones that I use to lift myself out of chronic fatigue syndrome. And I had extreme pain. I couldn't work for about 7 years. And I had so much pain that I was sleeping on an ice pack. I was driving with an ice pack. I couldn't eat any foods. It doesn't matter. But until I learned how to manage and control and make the changes in my lifestyle that I needed, I developed these 3 techniques that I learned from exploring complementary therapies for pain management. Okay, so there are 3 things. The first thing is just journaling. Now, you may not be a journaler. Let me get there for a second. I have all these things to tell you about. But what the research shows is that during the night, if you wake up suddenly, and it's not because of chronic pain, what has woken you up probably is what we call intrusive thinking. So it's those random thoughts that probably you've been suppressing during the day. I don't know if that's true. Would that be true for you? Yeah, very natural. You know, we have to cope with our stresses. We have to cope with cancer. So we find ways to manage, but at a subconscious level, there's so many things happening in our hearts and our brains, right? So what is found through research, mostly with breast cancer and a prostate cancer study, rheumatoid arthritis, chronic pain, endometriosis, migraine, it's a whole realm of illnesses that what was discovered is if people write for about 10 or 15 minutes before they go to sleep about what's troubling them, or it doesn't even need to be what's troubling them, it could be gratitude, but just expressing your thoughts doesn't need to make sense. You don't need to be fancy with your punctuation. You can do it on a computer, or you can just do it by hand. Some people still do that. I think it's fabulous. But what will happen is you have less intrusive thinking during the night. So it's a really, really easy technique to do. An example would be, I want to ask you right now to not think about a pink elephant. Don't do it. Who's thinking about pink elephants? Do you have an image? That's exactly what happens during the night. The more you try not to think about something, the more those little thoughts are going to go pop, 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 pop in the night. They're going to wake you up. So if you can write before you sleep, now you don't have to write about pink elephants, okay? Just write about whatever is troubling you, or whatever stream of consciousness. Now, okay, we're going to practice right now. Here's what I want you to do. If you have a little piece of paper, scribble. I want you to write, one thing that would help me improve my sleep is, complete the sentence. Even if you're not a writer, just try this, okay? This will help you tonight. Well, you can call me and tell me if it didn't. Betcha. Oh, you don't have that problem, okay. Don't call me at 3:30. I'm sleeping. Oh, you're not getting into the deeper phases of sleep well. Yeah. Now, Willem was sharing, this is common, and this is serious, right? That's why I'm saying, okay, so he's saying that you fall asleep well and you sleep a long time, but you're still fatigued during the day. So what's happening here, if we did a polysomnograph with electrodes, and we had him in the little sleep clinic overnight, and then we looked at what was happening with the brain all night, looked at what was happening with the oxygen, What else do we measure? Pulse, blood pressure, etc. We would see that you're doing phase 1, 2, and 3, but you're not getting 4, 5. 1, 2, 3, 4, 5. So it might take some investigation to figure that out. Yeah, this is a difficult one. It really is.
Apnea clinics and all that, right? But
You have, yeah. This is a hard one to sort out. Yeah, I know. Who else has that? Where you're sleeping a lot, but not feeling energized. It's not refreshing sleep. Yeah, very difficult. Very difficult. We can talk more about it. It's serious. What's happening is your immune function is being compromised more and more and more. You can feel it as you get older. It gets harder and harder to cope with, right? Then things start going wrong with other systemic, other physiological things start happening. And that's really kind of what's happening with chronic fatigue syndrome too. Stay and we'll talk more. So what did you write? Did everybody do it? I hope you did, even if you were resisting. One thing that would improve my sleep is, right? Who wants to share one thing? Yes, sir.
Well, just give a little preamble. My pattern is I'll go to bed, and in an hour and a half, I'm up and I'm flipping and tossing around. So I get up, make myself a bowl of cereal, I turn on the kitchen light, blah, blah, blah. Half an hour, go back down. Another hour and a half, and goes in. So my thing is, if I can learn to deal with my tossing and turning episodes in a more effective way.
Okay, good. Great. So this is step 1, do a little bit of writing. Step 2, let's do this right now. So here's how you do it. It's called the body scan. And if any of you, I know Ed has been through the meditation program at the Tom Baker, the meditation yoga mind-body therapy program. I want you to close your eyes right now, and I'm going to talk you through this just for 2 minutes. So what you want to do is, and let's all do this. I'll just talk. We'll just do a little bit of the body. So direct your energy. I just want to take your attention right now to your big toe on the right foot. Relax. Your awareness is in your big toe on the right foot. Now just take your awareness to your next toe and your third toe and fourth and fifth, and just kind of feel your toes right now. I want your awareness now moving along the ball of your foot on the right side, and just become aware of the top of your foot as well. Be thinking about that. Notice your right ankle. You're just kind of sensing your right ankle, and then the left ankle and the back of the heel. Now you're going to bring your awareness or your attention or your energy just up the leg a little bit, up the calf muscle at the back, and up the front of your shin, up to your knee. Notice your kneecap. Just feel the energy kind of at the back of your knee, on the right side of your knee on the right leg, on the left side of the knee on the right leg, and just direct your energy up even further. So now you're in the quadricep muscles, the hamstring muscles, the large leg muscles just below your pelvis. You can feel those muscles. Feel the front of them. Go around the side and the right side. Feel the inside of your leg. Just have your attention there. Up to the hip. I want you to think, does your right leg feel any different from the left? You can open your eyes. Does anybody feel any different on the right side compared to the left? When you think about your leg. Does it feel warmer? Yeah. Some people will feel a warmth. Some people will feel a heaviness. You'll just generally feel, it'll feel different. Now, the way this helps you get to sleep when you wake up is you're very busy in your head, not thinking about things that are bothering you. You're paying attention to your body. You may become aware, gee, I feel like I got a little pain on that side, where you may not have noticed that otherwise. But it's taking you into your body. Now, this is all described in the Jon Kabat-Zinn book called Full Catastrophe Living. Some of you are familiar with this book. To me, Marg knows this is like a Bible for me. It can teach you the body scan. You can do this to fall asleep. You do this through your right leg. You may feel a tingling. People feel different things. The left leg, then move to the left leg, go through the pelvis, go through the right arm, left arm, or even if you want to start at the face and just relax, become aware of your eyebrows and your eyes and your ear and just think it through. It's very nurturing for your body. Who's tried this before? Anybody? Oh, can you tell it? Has it worked? Who wants to share a little bit about the experience?
It has worked, and another occasion, I think, my mind's too busy.
You have a powerful mind, don't you?
I've been told that before.
You do. You know, we all do. We all do, and that's fabulous, but that's daytime stuff. We don't want the mind doing its thing at night. Night is for sleep, immune, building, regenerating, right? So sometimes it works for you, sometimes not. You got to keep trying. Okay, another technique, I'll just take 2 minutes with this one, all right? So 3 that I'm going to tell you about. First is the writing. The second is the body scan. Well, before we go further, who likes the body scan and can share a little bit of the benefit of it? A lot of you said you've tried it, Ed? Yeah.
The way we came across it was through Dr. Michael Specka and Linda Carlson down at the Tom Baker Center at Holy Cross. They have CDs with the body scan on it.
Mm-hmm. Does it help you get back to sleep quickly?
Well, I do it before I go to bed.
Do it before you go to bed. Did you drop
I
something?
had to go and get some coffee to keep me awake.
Oh, he's drinking his coffee. Yeah, so anyway, I want to encourage you to try the body scan. Is it worth a try? Who's willing to give it a try? It's very nurturing. How easy is it? And you might think, well, that's kind of repetitive. One leg, muscle here, next leg, muscle there. But who has repetitive thoughts in your head anyway? This is a little healthier than some of the other stuff that's going on in your head. Do you have a comment? Yes?
When I was in nurses training, we were taught how to do this. And you can actually just feel yourself like a ton of lead
sinking,
falling into the floor.
Yes.
And that really does relax, and lots of us had reasons to need to do it.
Nursing is one of the toughest professions too. You had a comment?
If you don't mind, I'm going to quickly share just one item. There's another, relative to the body scan.
Yeah.
I've mentioned a centering exercise, but I just finished teaching a lot of classes to our corporate employees.
Good.
And one of the elements or components of that was a centering exercise. And
perfect.
There's sort of a negative connotation to that, and some folks mentioned that you might be pre-smelling flowers and lovely babbling brooks and stuff. So it's really not. It's just a carrying the mind exercise.
It is.
I mean, it could be pre-smelling flowers and warm babbling brooks if that works. That's fine.
Yeah.
But it doesn't have to be that. Right?
I like the way you've explained that. That's very effective. All it is your monkey mind is doing something different. It's not draining your energy, it's nurturing the body. That's the only difference. You get really solid in the body. So it's a place to direct your mind and your energy. Okay, so the third one is the diaphragmatic breathing. I want to show you a picture, and we're just going to try it real quick. Can I have 5 minutes, do you think? Is 5 minutes okay? Is 5 minutes okay, everybody? Do you know what I realized? It's 9 and you're tired. If you want to just certainly leave, I completely understand that. Is it? Yes, it is. Oh, well, still kind of close to 9 o'clock. All right, the diaphragmatic breathing, many of you have learned this before too, but I want you to put it together to sleep tonight. Do a little bit of writing before you go to sleep. Do the body scan. Actually, I suggest you do the breathing first and then do the body scan. So diaphragmatic breathing is very relaxing, and it just takes you again out of your brain. Most of us, it may be a physical symptom that's waking us up, but it's our brain that keeps us awake. We can manage the physical body by nurturing it through these techniques. So now, when you inhale, I want you to notice that. If you close your eyes, please, just for a minute. When you're breathing in, and a diaphragmatic breathing, ideally what you want, as the lungs are filled with air, your diaphragm is a muscle between your stomach contents and your lungs, and it's going to push down to allow the air to come in. So when it pushes down, your tummy is going to bulge out a little bit. Now this is, you watch a baby breathe, they know how to do it. Mostly as adults, we forget how to breathe properly. And you know what, you don't need to worry about it too much. We're all really good at breathing. But when you exhale, I'll stop talking in a second, we're going to do this. Your stomach actually, as you're exhaling and the diaphragm is pushing up, your stomach will flatten a little bit, right? So when you're lying down, you can actually put your hands right on your tummy and just breathe in a relaxed manner, and just notice if you're breathing well and deep into your chest that way. Now, this is a practice that takes a bit of time to learn. So tonight, when you're doing your breathing, I just want you to breathe normally, all right? And what I want you to do is count your breaths. Each time you breathe in and out, count 1. Breathe in and out, count 2. In and out, count 3. I'm going to stop talking in a second and we're going to try this. I want you to see if you can get to 36 breaths. I may interrupt you a little bit before that, but count the breaths. Now, when you notice you're thinking about something else, as soon as you notice the thought come, you have to go back to 1. All right? I want to see you can get to 36. Ha ha. I want to see you can get to 10. Okay, I'm going to stop talking now. Begin to count your breaths, just quietly, just relax a little. I'm going to stop you now. Just open your eyes. How many had 5 breaths? Good, fabulous. How many got maybe to 3 and then they noticed a thought going zinging by? Yeah, how many? Oh, tell the truth. Tell the truth. A lot of people can't really get past 3 or 4 breaths. And it doesn't matter. It's fine. What you do, though, to get to sleep, so easy. Just start this practice, get to 3 or 4, and you're thinking, oh, Chris, I don't know what this stupid idea she talked to me about today. I mean, maybe, yeah, although I don't know. Oh, back to 1. Okay, 1, 2, 3, 4. Yeah, I don't know if I'm worried about tomorrow anyway. Oh, okay, I'm not paying attention to my breathing. Back to 1. Now, pretty soon you will be asleep, in spite of chronic pain, in spite of all the things that may be affecting you. Seriously, who's used this to go back to sleep? Oh yeah, you're going to share.
No, you know, they do that, and they also do the Monday exercise. They're massive total. Yoga, when you do that at the end of the class,
yeah.
You're sleeping 2 minutes.
Does it help you?
Yes.
Yeah. So you just have to be disciplined. It is a discipline, but it's so important. You're strong people. Look what you're dealing with already, okay? You're very strong. You can do this. It's extremely important. 3 steps, okay? So I'm going to, what I'm going to do actually is just, if you want to sign up for my newsletter, and it's really irregular, sorry to walk in front of the screen, I'll just put this here. I'll bring a pen over. If you'd like my newsletter, just leave your name. And I can get some resources to you if you want to send me an email. My email is, my website is on the bottom of the little handout that I gave you. There's all kinds of ways to conserve energy. Just get in touch with me if you'd like a consult, or we can talk more. I know we're really short of time here. Know that it takes time to improve your sleep, but it's worth it. Even if you just sleep about 10 minutes more, or you get back to sleep a little faster, it's going to benefit you. Your immune system will thank you. The top ways to improve your sleep. Okay, we're going to make an action plan. There's a form coming now. that. But I want to make a quick comment about sleep medications before I go. The form that you're going to get now is called Action Plan as well, but it's a colored sheet and there's a little pathway there. It just describes the 3 steps that I talked about: the expressive writing, the diaphragmatic breathing, or the 36 breaths, and the body scan. Okay, now at the bottom there's 3 spots here that I want you to commit to changing something in your sleep environment. That's all you need to do to sleep better tonight, is these 3 steps. And then on the weekend, what's today? Tuesday. Or as soon as you can, you're going to get a sleep mask, you're going to get your dark blinds up, you're maybe going to invest in a new bed. If your bed is over 10 years old, you probably should, your bed is needing to be replaced, even if it's real comfy, okay? So have a look here. Okay, let's have some questions. Anybody with questions? Yes, sir.
I don't know whether I missed it. Is there an ideal temperature for your bedroom?
Yes, but I don't necessarily agree with it. It's about 68 degrees Fahrenheit. What is that Celsius?
20.
20, which is too warm for me, but you'll know. I don't think you need to follow any guideline. Should be a cool room with ventilated air.
So yeah, I think most of us turn our thermostats down at
Yes, you should do.
And I'm wondering if we should turn it down even more, whether you'd get better sleep or longer sleep.
Not necessarily. You know what? It's like I say, my personal approach is a little bit different. I don't think you should focus on anything outside yourself. You have to learn how to sleep if it's too hot, if it's too cool, if you have a little bit of noise, if you have pain, if you have a really troubling decision, etc., you still have to find a way to sleep. That's how important it is. You can't really control everything in your environment. But if you sleep better with the temperature lower, yes, I would sleep better, but not everybody. Some people really like it warm. They like a down comforter. Everybody's different. There's no rules about it.
When you go to a clinic and have the night sleep testing on your brain, what temperature do they use?
Probably 68, yeah, which may or may not suit you.
Yeah, right.
Yeah. Other questions? Yes?
Well, early on you made a comment about melatonin supplements, and I take one before I go to bed as a matter of routine.
Okay.
Is that a problem?
Probably not. Did you talk with your physician about it? He or she knowledgeable about it? What do you take? 500 milligrams?
I don't know. I can't remember it. It's not very large. It's probably less than that.
You may be taking 250.
Yeah.
Do you find that it helps you?
It's such a routine, I just don't know anymore.
Okay. Do you know what I'm going to suggest? Melatonin supplements can be, the studies are so disjointed, it's not really clear. Some studies show that melatonin is actually protective against cancer because it's an antioxidant, natural hormone in the body, right? Other studies say because it has such wide-reaching effects in the body, you may be creating unexpected or adverse effects, as you may sleep better, but you may be changing your endocrine system on some levels too. So you would have to put the whole picture together yourself. I would actually try these 3 methods first. Experiment a little bit, practice these, and you do some of them already, I know.
Stop taking the melatonin maybe?
Slowly, just experimenting with it, but being very gentle with yourself. It's a very powerful antioxidant hormone. Just know that. The research is really mixed, and that's why I'm kind of saying there's this and there's that. It's not really clear. I feel if it's working for you, that's great. It obviously isn't harming you. Other people may not be reacting as well. Ed?
Chris, one important thing to know about melatonin, unlike a lot of other sleep medications, it is not addictive. Not addictive.
Yeah,
as long as you take up to 10 milligrams.
Yeah, that's a really good thing, yeah.
Well, that's true, and it's so much better than a pharmaceutical medication that you might take. The research is just coming now. I had stats earlier. Look at this. Emergency room visits tied to Ambien and other sleep aids jumped 220% in the past year. very serious overuse, tolerance issues, withdrawal issues, etc. If you can get off your sleep meds, that's great, but do that with your doctor's supervision together with these techniques. These techniques come first, and then if they fail, then you add on a medication. But most doctors aren't well trained with this, and they go too quickly with medication as a solution. One more question, and Willem was going to close. Yes?
What about reading before bed? And reading can be different modes today. So reading with the light attached, reading with the backlight, white on black on an iPad. Are those problems?
Well, the research isn't developed yet to investigate that. And my thinking is, if you're sleeping well, there's no worries. But if something is disturbing your sleep, you have to look at all elements of what it might be. Now, the good thing about those little pads is you can have a dark room and just a little bit of light. But if that hurts you, some people that would hurt their eyes to have that glaring screen. But I know screens are designed to be soft. So again, there's no clear answers. Only you would really know. Yeah. Do you sleep well?
Oh, it's not me.
Oh. I would personally discourage any of my loved ones having that electronic light close to their face and their brains at night.
What
Yes?
about the radio all the time?
Well, music is different because you could have your eyes closed and it's not influencing the light. If you have white noise, that's helpful to some people too. Music, it can be a beautiful way to sleep better. Is that what you mean, to have music on?
No.
What do you mean? Sorry about that.
Old stories, old radio programs.
Uh-huh.
And there's a lot of action and whatever.
Yeah, but are you lying gently, quietly with your eyes closed?
He sleeps through it.
Oh, so that's not good. That's not good. Oh, I actually have a neighbor who falls asleep with the television on too. Yeah, I'm sorry. So I'll stay as long as you want and we'll talk more. Just come up with your question.